Rachel, I'll get Hess. You get feed the children. Get J.C. Watts to help with that. Okay. Well, I'm not going to embezzle. So anyway, our guest is Chelsey Fry. She's with Advanced Therapy Solutions. Born in Fort Smith, raised in Orlando, Florida. Graduated at Timber Creek High School, undergrad in communication science and disorders at Oklahoma State in 2013, master's in speech pathology 2015. In addition to this, she owns a vintage booth at the Memory Lane Vintage Mall on 10th Avenue. So she will shamelessly be plugging her antiques after she talks about advanced therapy solutions. So come on up, Chelsey.
Okay. Okay, can you hear me okay? All right. I was hoping I was tall enough. I even have my big shoes. Thank you guys so much for having me. I'm so grateful to be here today and thankful for the opportunity. So I'm just going to talk about Advanced Therapy Solutions and who we are, the services that we provide in Stillwater, and then answer any questions that you guys have. I will say that we do serve all ages, so we serve the lifespan from birth and on with speech and occupational therapy services. But today I'm just going to focus on our adult services that we provide just for time's sake. So if you do have questions about the others at the end, just let me know. And I think some of your brochures has information about the kiddos too. So there's me. He already gave me an introduction, but I'm the lead therapist at ATS. So I see patients and then I help with some stuff behind the scenes. This is the owners of the clinic. So this is Blake and Abby Odell. They're wonderful people. I actually went to school with Abby. We were in undergrad and graduate school at OSU. Go Pokes. So she and I get to work together now, which is really fun. And she's wonderful. So she started ATS in 2017, actually. She just wanted to provide private practice services in the community and thought, I'm going to take a shot at this. So it started with just her, and we have just been growing and growing and growing. Right now, we've got some hires kind of in the works, but right now we have 7 speech-language pathologists and assistants. We have 6 OTs and assistants or CODAs, and then we have other 6 to 8 office staff, support technicians and things. So originally she was in like a really small one office, lobby situation, and then she moved. Right now we're located on Perkins, right by O'Reilly's in that rock building with the green roof. And so we're in there now, and we have since busted down some walls to add on in there, and now we're growing out of that facility. So if you know of any place, let us know. But that's where you can find us. This is our therapy dog. We can't forget him. His name is Splash, and he's a sweetie pie, makes everybody happy. So speaking of growth, it worked out that I was coming today because this last Saturday we actually attended the Cowboy 100 Gala, where they honor cowboy-owned and cowboy-led businesses that have experienced growth over the year. And so this year, ATS was ranked number 18 out of 100, which was pretty exciting. Last year, I got to go as well, and we were 37th, so it was fun to see us kind of move up. And there's some of us who went. Okay.
I was number 50-something.
You were? Were you there?
Barely 50.
Barely 50.
Aww.
It's a screw job, but
See,
should have been 17.
should have been. Okay.
Next year I will.
Okay, we'll see. I'm usually there. So a little bit about us. Like I said, we do provide speech and occupational therapy at our facility, which includes swallowing, speech language, cognitive, voice, and then we also have lymphedema therapy. So I'll talk about that towards the end, which is kind of unique for us. We really just specialize in making sure that we provide quality services for everyone who walks through our door. Everything we do is research-based, evidence-based. We want to make sure that we have the most individualized therapy plan for our patients and based on their goals, not necessarily what we think is important. So I feel like we do kind of pride ourselves in that. So here's another picture of inside our facility, and we'll just kind of talk about the kind of symptoms that we treat, or some things that you might wonder about if you do need services, or if someone that you love needs services. So a lot of the things that we will help out with are up here. So I'm sure you've heard, you may or may not have heard, that speech pathologists do help with swallowing and swallowing disorders, as well as feeding disorders. So picky eating, sensory aversion in little kids, or following surgery, things like that. So anyone who has difficulty swallowing their pills or their drinks, or they're coughing at mealtime, or they can't eat what they used to. We also help with anything speech or language related. So being able to produce the words that we say clearly or loudly enough. If we are having a hoarse voice because we've had vocal trauma, some people have trouble with word recall or remembering names, remembering places, having any sort of memory deficit, regardless of what's causing it. And then again, we do help with swelling, so that lymphedema. We have a therapist who can help with that in the extremities and arms, head and neck. So a lot of the diagnoses that we see, this is not all encompassing, but this is a lot of what we see walk in the door that's causing a lot of these symptoms. So anyone who might have experienced a stroke, or a Parkinson's disease, neurological progressive diseases like that, dementia and Alzheimer's, any sort of brain injury from a car accident or something similar, voice and swallowing disorders, and then head and neck cancer. We do see quite a bit of that as well, and lymphedema. So just for today, I'm just going to kind of break down the categories that we treat for adults into just 4 separate components, just to make it a little easier. Speech pathology is kind of tricky because it is very broad, and a lot of people don't know that. So these are just some of the things that we can help with, and these are things that I specialize in personally and that I enjoy treating as well. So I'm just going to go through each one of those. So speech, language, and cognitive therapy. Hello? There we go. So what does that look like? It can look like a lot of things, and I kind of touched on this, but someone who needs help with their speech production. So the way their sounds are coming out, are they clear? Are they garbled? Did they have a stroke and now nothing makes sense? Those sorts of things. We can provide you guys with different strategies that you can use inside and outside of therapy to rehabilitate those symptoms, depending on the cause. We can also help with word finding and being more fluent in our language. If we have an individual who, the words are coming out in the wrong order, or they're stopping several times because they can't think of a word that they should know, there are techniques that we can do to help kind of reform those connections in the brain to make it easier for them, especially if it's not long after an event like a stroke or something like that. We can also help with memory skills and individuals with dementia. Like I said, a lot of people think, that's kind of a poor diagnosis because it doesn't necessarily get better. But there are things that we can do for caregivers and families to help them manage it as it progresses, as far as compensatory strategies and things to help them in their house, to help them be safe and independent. Same thing with problem solving and reasoning. Sometimes we have individuals who come and they can't manage their finances anymore, or their medications, they're forgetting which ones they need to take, and we can help with that. And really the end goal is just making sure that every patient we see has functional communication. So whatever that may look like, whether it's with spoken language, whether it's writing, pictures, we do a lot of AAC, or augmentative alternative communication, for both kiddos and adults. So you've seen, the screens where you can either look at it and it'll talk for you, or you can push some buttons. We'll do anything we can to help you meet your goals. As far as swallowing goes, this is one of my favorites. Again, We might have issues swallowing from various reasons. We can help you know what the cause of your swallowing issue is, and then help you avoid these episodes that are causing you to cough or to choke or to feel like you're aspirating, which can be dangerous because over time, aspiration is going to cause pneumonia in the lungs, which can make you very sick. So that's always our goal, is to make sure that we're providing you with the best diet plan. So what foods you're eating and drinking, what's safest. We can give you exercises to help strengthen these muscles that are used for swallowing, and also just help you with, maybe you need to swallow twice, maybe you need a drink after every bite, different things like that. And then also just education. A lot of people don't really know that there can be trouble swallowing, and then when it happens, they're, thinking, what is happening and why is this happening? And so we can help them understand it as well. A few of the specialized treatments that we have for dysphagia or swallowing at ATS specifically are listed here. So there are 3 of us, speech pathologists, including myself, who are certified in AMP care, which is a neuromuscular electrical stimulation therapy. You can kind of think of it as a TINS unit, but it's not like that. It helps retrain those muscles, and we see a lot of rehab quicker with it. So I've seen so many people come in on a feeding tube, they've had a stroke, can't eat anything by mouth, they've been deemed unsafe, and within a few months of coming in a couple of times a week, they're eating whatever they want. So it's very rewarding to see. We also use some MDTP, which is just a specialized exercise program, and then manual therapy. And our biggest thing we're working on right now, it's not finished, but it's in the works, is we will have the ability to perform fees at Advanced Therapy Solutions. I think Sherry Norton was here a couple weeks ago with OSU Speech Language Hearing Clinic, so she may have touched on this a little bit because I think they have the capability now at OSU. But it's basically an endoscopic evaluation of your swallowing. So it's just a small camera on a scope that we can pass through the nose, look in the throat, and we can watch individuals swallow in real time to see what's going on. Why are they aspirating? Is there redness? Is there swelling? Is there reflux? How are those vocal cords looking? We also are going to have stroboscopy with ours that will allow us to watch the vocal cords vibrate in real time so that we can help diagnose voice disorders. And so this is a picture of me. I guess it was February. I went back to my hometown in Orlando, Florida to take Dr. Eric Blicker's course, and we learned how to scope. So that's me scoping the mannequin before we scoped individuals for about 4 hours straight. But it's very rewarding. So in a couple months, we'll be finished kind of rolling that out, and we'll have that availability to help us better serve our patients. And then as far as voice therapy, this would be if you've had some sort of trauma to the vocal cords, whether it be from an intubation, a surgery. Parkinson's disease can affect the voice, aging can affect the voice, or even just what we call some vocal abuse. So maybe you spend too much time yelling or cheering, or you're just very outgoing. You can cause some damage to those vocal cords over time. And so we can help you restore that vocal function and learn healthier habits to make sure that your voice is clear and understood. We also have some cough suppression therapy. We saw a pretty big rise in habitual coughing after COVID, where people would get a virus and then they just have this cough that lingers and lingers and lingers. And over time, when you're coughing, those vocal cords are just slamming together in a way that they're not supposed to. So they become very swollen, very irritated, and that voice can just get hoarse and you don't quite sound like yourself anymore. So there are some techniques that we can use to help you change that habit and heal your voice over time. We also do have some specialized voice treatments. I think Sherry talked about Speak Out as well through the Parkinson Voice Project.
I'd just like to point out, do you hear everybody clearing their throats
I
now?
did. I did.
No, I mean, we're all doing it.
Yeah. Throat clearing is also not good for you, just so you know. Swallow instead. But we also have Speak Out through the Parkinson Voice Project. I think 3 of us are certified, but it's a specialized program for people with Parkinson's to help maintain their vocal strength with disease progression, and we can use it with other diagnoses as well. And then we also offer some manual therapy. Whoops, I keep doing that. I don't like technology. Okay, lastly, we have our lymphedema therapist. So this is Tammy Wales. She is our occupational therapist who is certified in lymphedema therapy, and she helps with reduction of the swelling and edema that I was talking about. So I don't know a whole lot of what she does, but I know the gist. Basically, it's just lymphatic draining. Lymphedema can be caused by cancer, radiation, if there's surgeries to remove lymph nodes and things like that. So she can help you understand the swelling. She provides manual compression therapy at our clinic, and then would provide like a home exercise program to make sure that you're maintaining the circulation that you need for the drainage. And she's wonderful too. So those are basically like an outline of the adult services that we offer, which will help with anything you need basically if it falls within those parameters. We do take insurance, so we're an in-network provider for most major insurance companies as well as Medicare. A little bit about Medicare, just because it can be confusing. So we cover Part B, or Part B services cover what we offer. So if you have Part A and Part B and you're receiving Part A benefits currently, like say you just had an event and you have home health coming out for a couple weeks or something, you cannot seek separate Medicare B coverage at that time until that Part A coverage is ending. So that's just something to keep in mind, and you can always call and ask about that if you have questions. And then we also have self-pay, so if that's something that you want to do, that's an option. So if you or someone you love is interested in our services, what do? Basically just give us a phone call, let your doctor know. Most insurance companies require some sort of referral. So once we get a referral in, we'll contact you and figure out what you're needing, schedule an evaluation with you once we've done your benefits check and all that, and then start therapy with one of us. So if you need help getting that referral, we're happy to help call the doctor and help them know what to do. But it's pretty simple. And that's all I have today. You guys have any questions?
All right, who has questions?
So what am I supposed to do when I need to clear my throat?
Oh, good one.
Okay.
That would be a very helpful tip today, apparently.
Yes, so swallowing instead is better. Sometimes it makes that tickle go away to where you don't feel like you need to cough. You could also take a sip of water, suck on some ice chips. Sometimes a sniff swallow will help a little bit, like if you swallow. And if you do like a hard squeeze when you swallow, that really helps too. Try it out.
How often has your clinic here dealt with persons diagnosed with ALS?
We have had a handful the past few years. Overall, I wouldn't say a large percentage. I have had quite a few with progressive supranuclear palsy, or PSP. It's similar, but not as
It's not the same.
progressive, no. But it's progressive in nature. But I do know that Abby did have one with ALS.
Well, has there been any success with those persons diagnosed?
So that's a very trying diagnosis because it is progressive. So our role in that is basically to provide support. With ALS, there is a slow progression of losing the ability to speak. And so what we would do with those patients is get them one of those devices as soon as possible. We can do voice banking, where we actually have them basically save their voice and all the different phrases that they would typically use. There's software for that. so that when they do start to lose that ability, if we can get them a device that they can use their eyes with, it still sounds like them, which is really nice for their families.
Your timing is excellent. I have a relative who developed lymphedema recently after having had lymphoma many years before. So is there a strong success rate in sort of controlling that? Is it just sort of, tell me more about what the success rate looks like after some treatment for that?
Yes. So like I said, I don't know the ins and outs of lymphedema therapy personally, but I do know Tammy has very, very good success. I don't know how long of a time frame it usually takes to get where you want to be, and that's something that I could definitely ask her, but I do know it's pretty successful as far as long-term maintenance as well. So, yeah, you're welcome.
Chris has one.
No, this is easy. Orlando, Florida to Oklahoma State.
I know.
What was that tie?
My husband. I know. Yeah. Followed the
Whoa.
boy. I followed the boy.
From was he in Orlando?
No. It's even more confusing. No, so
Well, we got 10 minutes.
Okay.
So,
So I always said I would write a book, and then I never did it, and now I forgot all the details. But basically, so I was growing
Club
up there.
supports literacy. We would buy your book.
Okay. Yeah. So I was born in Arkansas. My parents. Yeah, yes. I hear you. Pig Suey. So we moved to Florida after my parents separated, and then my dad stayed in Missouri. I know, it's weird. Anyway, I would spend my summers with my daddy, and my husband was living in Missouri. So we met when we were 16, and then
it's really none of my
I
business.
followed him.
And the rest is history.
Get to Orlando to Oklahoma State.
I know, it's so random.
It was a
I know.
boy.
Larry Hoborock came out and gave
Larry Hoborock recruited her. It's fine.
it's
Oh,
fine. It's
Michelle has a question. Sarah's coming for you, Michelle.
When you're doing the endoscopic scoping, like, are people medicated during that process? What does that look like?
So no, it's actually pretty non-invasive. I know it sounds invasive, but
I had a COVID test, and so
Yeah. Okay, yes, that does make sense. So in the nasal cavity, actually, the further up you go, so there's 3 different turbinates in there. If you stay in the lower one and just go straight back, there's not a lot of sensory fibers, so you don't really feel it. So the COVID test is more like shoving it up there, which has more nerve endings, and so that's probably why. But it's really supposed to be pretty comfortable. So
It doesn't look comfortable.
I know.
I wonder
It's
if
not very long.
she's
either.
probably really good at it, though. I bet some people suck at it, but you're probably great.
No pressure. Yeah. No pressure.
Sorry, we're practicing technology today.
Hey, I don't like technology either.
I just want to provide a testimony for these folks. I saw them a few years ago. I was having some real difficulty with my voice,
Oh, okay.
and my wife still holds it against them that I got my voice back. But my voice is much better. They didn't quite get me to Andrea Bocelli, but it is better than it was, and they were very, very good. Several weeks with them, and so
Thank you for that.
there's somebody that survived their treatment. So.
Fantastic. Okay, anybody else? All right, let's have a round of applause, please.
Thank you. Thank you for having me.